Let's get going. Hello, my name is Nelson Graves. Welcome to News Decoder's Town Hall on the coronavirus. I'm joining you from lockdown in southern Normandy in France, and I'm joined on camera by our guest expert, Maggie Fox. We have a student from one of News Decoder's partner schools and my News Decoder colleagues. And Maggie, Janae Rose, and colleagues, would you like to introduce yourselves briefly? We'll start with Maggie, perhaps.
Hi, I'm Maggie Fox. I'm a longtime friend and colleague of Nelson's. We worked together at Reuters news agency for a long time. I'm a health and science journalist. I'm currently writing a book about healthcare in the US, but of course, like everyone else, I'm fascinated with the coronavirus, and so I'm doing some occasional reporting on coronavirus and blogging about it.
Thank you, Maggie. Janae Rose, you want to say a few words about yourself?
Sure. Hi, I'm Janae Rose, and I am part of SYA Spain. And I've
what's SYA, Janae Rose?
Oh, sorry. School Year Abroad Spain. It's a 9-month program where students, mainly American students, go to Spain and we study and try to learn the language. And I was recently affected by the coronavirus because I was sent home 2 weeks ago. Because of the coronavirus.
In a real rush, I believe, right?
Yes, because on Monday we thought that we had time, and then by Wednesday we were all told we have to leave as fast as possible.
We'll learn more about that maybe later. Lauren?
Hi, I'm Lauren Huser. I am the Chief Strategy Officer at News Decoder. I am based in Toronto, which is also more or less in lockdown.
How's your first Prime Minister? What do they call the First Lady up there? The first.
They don't have a name for. I don't think they have a name for her.
How is Sophie doing?
She's recovered, but I think still isolating. I think her and Justin are still working from home.
All right, good. Savannah,
Hi, I'm Savannah. I'm the communications manager here at News Decoder. I'm also on lockdown in Paris, France.
And you have your taste and your smell back?
I do.
Good.
It's for a while, but it's back now.
Dylan?
Hello, my name is Dylan Carlson. I'm also here in Paris on lockdown, and I'm an intern for News Decoder.
Thank you, Dylan. Where were you born?
Mexico, León, Guanajuato.
There you go. Terrific. Thank you, guys. Well, I'm not going to spend a lot of time with a lengthy introduction, but just a few more words on Maggie Fox. Maggie's been covering health and science for more than 2 decades. And before that, she covered conflict, politics, and other international news events from London, Hong Kong, and Beirut. She covered the cloning of Dolly the sheep. She has covered stem cell technology, vaccine controversies, and in the context of this session, numerous epidemics, including AIDS, HIV, Ebola, SARS, H1N1, and now COVID-19. She's worked, as she said, she's worked for Reuters, but also for the National Journal and NBC News, and she lives in Washington, D.C. Now, Maggie will make a few opening remarks, and then we'll move right into Q&A. We want this session to be interactive. And so those of you who are not on camera, please use the chat box to send in questions or comments. And if you'd like to appear on camera to ask your question or to just participate on camera, just say so and we'll elevate you to camera position. The session will last 1 hour and we're recording it for those who can't make the live session. So with that, let me turn over to Maggie. Maggie?
Thanks, Nelson. Well, I've already received a few questions ahead of time, and those are real interesting to hear, but I'll just give you a little background and context about how journalists and journalists like myself have been preparing for and covering something like this. We've been warning and been warned by public health officials that a pandemic like this was going to happen. The likelihood has always been given as 100%. I think a lot of attention got focused on the possibility back in the late 90s and the early 2000s when there was an outbreak of H5N1 bird flu that spread from ducks and chickens, apparently in China, into people, and is still causing the occasional outbreak. But it got public health officials focused, and a lot of us journalists got focused on the idea that there might be a big pandemic coming. At the same time, some books were written looking back at the 1918 flu pandemic. And I know everybody's hearing about that again now, but in 1918, at the height of World War I, there was a pandemic of influenza that, as we know, killed anywhere between 50 million and 100 million people around the world. It was particularly horrifying because it killed people very quickly. You'd be perfectly fine in the morning and literally drop dead hours later, and it affected young, healthy people. Despite the fact that there weren't flights, there weren't large international connections, this pandemic spread around the world pretty fast and kept killing people for a couple of years. So that history combined with what was happening in China got people focused on the idea. And sure enough, right just in time to scare us all and kind of justify the attention, there was this outbreak of SARS. And when that first started in China, a lot of people were paying attention to it, especially the journalists who had become interested in the idea and the risk of a pandemic. And there were a lot of officials who said, let's pay attention to this. At first, we thought it was H5N1, finally mutating into the form that we had all feared, something that was easily passed from one human to another, but was still very virulent. As everybody knows now, SARS was stopped, but it took a while and it scared people. It infected about 8,000 people around the world and killed about 800, including some of the doctors who were fighting it. But they were able to start it. So you have that to stop it. So you have that context, people paying attention, and governments around the world decided that they really wanted to get the world ready, and they enlisted journalists like me to kind of run exercises with them. What's going to happen with the next one? How will we handle it? What will the disease look like as it spreads? How will countries respond? And for us, how will the news industry respond? And how will you shape the story? And how can public health officials help you as journalists tell the story accurately when this actually does come? So a lot of us took part in what were called tabletop exercises at the Health and Human Services Department and with national security officials in Washington. The World Health Organization also ran a few of these, kind of enlisting the media to be part of the planning and the response. So for years, we've all been paying attention to this and issuing regular warnings saying, the world knows about this, but guess what? We're still not ready. Let's do a bit more. So in 2009, people were really ready to jump when a new type of influenza was discovered on the southern border between Mexico and the United States down near San Diego, and it turned out to be H1N1 swine flu. And people swung into a big response. Most young people don't remember it, but there was a huge response at first. The CDC rushed out diagnostic tests. The idea was, if we can do what we did with SARS, which is catch every single case, isolate every single person who's infected, and then get to everyone that they've been in touch with, maybe we can control this. Well, as with any kind of influenza, that turned out to be impossible. Luckily, however, H1N1 turned out to actually be a fairly mild form of flu. It did kill a lot of people, and it especially hit children hard, but it wasn't as bad as anybody thought. After that, it seems like preparations kind of just fell apart. We had a few scares. We had Ebola, which no public health expert ever thought was going to turn into a global pandemic, although it was absolutely horrendous in the region when it hit West Africa. And then there was Zika, which also frightened people, but it's slightly different because it's not spread person to person, and those diseases that are spread by mosquitoes require a different response, and that was also limited by weather and temperature and by whether mosquitoes are common in an area. Then we got a Trump administration that decided it wasn't going to focus on these things that had different priorities. At the same time, governments around the world also seem to lose interest in this particular matter of pandemics. Despite having many warnings and many wake-up calls, the world basically let it go. They stopped funding the World Health Organization's efforts, and WHO continued to try to keep people interested, informed, preparing. The word was that around the world, especially in developing countries, your best defense against any pandemic was always going to be building up a better health system in these countries so that they could react quickly. Despite that, people stopped sending in their pledges to WHO. Governments haven't funded it to the level that WHO said they required, and governments themselves didn't do very much to build up their own public health systems by and large. So now we have a world that's highly, highly vulnerable to this virus. Despite what some politicians have said, this virus did not come out of nowhere. People were paying attention in December when something was causing a mysterious pneumonia in China. It's the first place you look. When something starts happening in China, you're paying attention. Boy, are you paying attention, and people were. The Chinese government, which had covered up SARS at first, did at first try to cover up the fact that they had something else spreading. But there were warnings from the very beginning. The problem was that governments chose to ignore them, chose to play them down, and we now have the mess that we're in now, which everybody's familiar with. This virus spread long before there were any restrictions on travel in or out of China and in or out of any other country. And as predicted by public health experts, and they've painted a beautiful picture of this, it's like there's going to be a central fire, and then the sparks are going to fly. And they fly over walls, they fly over oceans, they can get past any kind of barrier that you want to put up, and they start their own conflagration. And just like those fires in Australia, once a new fire is started, it doesn't matter what you try to do to keep new seeds from coming in, that one's going to start and seed itself. The predictions are that this pandemic will last for many months, and that eventually this virus, because it's very similar to other viruses that already circulate, will probably join the mix of annual things that make people sick in cold and flu season. But until that happens, we've got at least a year probably of misery, of a great deal of death, of people racing to develop drugs and vaccines to treat it, and doing what they can do to control it in their populations. At the same time, we also all know that this creates uncertainty, and that hits economies. And so there will be great economic swings. I don't think people are ready for some of the changes that are very likely to take place as businesses go under, as international trade is disrupted, as that then affects other industries. People lose their faith in anything they can invest their money in. Right now, stock markets are very uncertain, municipal bonds are very uncertain, and currencies are very uncertain. Investors are left without places to put their money, and I don't think anybody can really predict what the long-term effects of this are going to be, but they're going to be serious. These are all things that journalists should be paying attention to, and that people as citizens should be paying attention to. And unfortunately, we're getting distracted by some of the politics that are surrounding all of this. And I think it'll be an interesting conversation over this hour to hear what you all are experiencing and what your thoughts and questions are about what's happening now and what there is to come. So I'm going to leave it off there. And I think this will be much more interesting as a discussion rather than a lecture from me. So Nelson, I'll open it up to the questions that you've seen.
Nelson.
Thank you, Maggie. We have two questions that have come in. One from Elaine Monahan via chat, and then we have a question also come in through the Q&A, which one can use, from Brian Thor. And we'll get to those questions in a minute. Thank you, guys. And if others have questions, please forward them, and we'll address them as soon as we can. But first, pride of place to you, Janae Rose. Would you like to be the first one to ask a question insofar as you're our student representative on this panel?
Sure. Do you want me to read one of the questions from someone else, or what am I?
Or whatever's on the tip. What do you find to be the biggest question that you want answered?
So for something that I think about a lot is how you just mentioned, Maggie, that you suspect that this virus will become one of the other viruses that just happen, that becomes more normal. So when we get back to, regular life, how do you think we'll be able to reintegrate ourselves into going out and going to concerts maybe and being in big groups again?
That's a really interesting question, whether this will change people's behavior. I go out and walk every day with a friend, and we've been discussing, what will happen. And I've been noticing as I go out and walk here where I live in the DC suburbs, we're still allowed to go out and exercise freely as long as you don't go out in big groups. We've noticed that there's a lot more people out and about. They're keeping their distance from one another. And we were just discussing how we hope that maybe this will make people value the ability to go out and exercise and do things while at the same time being cautious in groups. One of the things I've written about is that there are a lot of respiratory diseases, and as coronavirus was first spreading, it was still the height of the cold and flu season, and I was realizing that people might not be able to tell whether they had coronavirus or something else because there's so many other things that cause precisely the same symptoms. I am hoping, and this is just my hope, it's not based on any evidence, that people will realize and begin to value that a lot of their behaviors spread all sorts of infectious diseases that kill people every year. Pneumonia caused by a variety of viruses kills 50,000 people a year in the US alone, hundreds and hundreds of thousands of people around the world. So perhaps people will develop a bit more respect for all of these viruses and respect for one another in their behaviors that spread them.
We've got 3 questions in addition to Elaine Monahan's. The first one, now 4. First one from Bryant Zor. Maggie, do you predict consistent extensions of social distancing guidelines throughout the summer and possibly fall? Now, this person clearly lives in the Northern Hemisphere, summer being on the cusp and fall being a few months away, and the Southern Hemisphere would be different. But so do you predict consistent extensions of social distancing guidelines throughout the summer and possibly fall?
I want to say something right here and be very clear. I am not myself an expert. The only source of expertise I have is talking to other public health experts. So anything I tell you is based on what other people have told me. I'm lucky that I've assimilated a lot of it over many years of this kind of reporting, but what I'm relaying to you are not my own personal thoughts or beliefs, or at least I'd like to try to avoid that because as a journalist I shouldn't, but this is what I've heard and read from the experts who I've come to trust and understand that they know what they're talking about. What they're saying is a lot, that the answer to that question is one that we don't have because a lot depends on how people behave over the coming weeks and months. If cities, states, localities relieve some of the restrictions early, everyone's generally predicting a rebound in virus in that area, in which case there will have to be more crackdowns. And you could end up with this pattern of sort of restrictions and then they relieve them and the case counts go up and then more restrictions and they go up again. In general, what the computer models and the people who are experts at modeling these things say is you actually have to live through a long period of restriction to stop the threat of further spread. This is also a virus that's affecting the entire world, so we're all in it together. So if 1 or 2 localities do let up on the restrictions too soon and allow the virus to start spreading again, it's like a fire. It will send out sparks to everywhere else, and it will lengthen the amount of time that there will have to be restrictions. So this is one we're going to have to wait and see play out. It's possible everyone will do crackdowns and hold to them for long enough that the virus just stops having new people to spread to. And it can be controlled until there's a treatment or a vaccine. This is one where you have to say, we'll wait and see.
Isn't that, if I could just piggyback onto that question, isn't there a time, isn't there a moment when a community, when enough people in the community have been exposed that thereafter it actually stops spreading? And if that's the case, by practicing social distancing, are we actually putting off the point at which enough people would be immune that it would no longer have an effect?
Yes, that's called developing herd immunity. And what you can do is just let the virus spread and let everybody get infected, and then you will have herd immunity, because this is a virus that the human population has never seen before, which means that every one of us is vulnerable. There's nobody out there who's immune already. So over time, a large number of people are going to be infected. So what you want to control is what period of time does that take place in? You can take the hit all at once right up front, but boy, are you going to have a lot of dead people. And you're going to have more dead people than the virus is actually killing, because what happens is your hospitals and health systems become overwhelmed. And then nobody who needs treatment is going to get it. So you're also going to have people dying from accidents, dying from heart disease, dying from their medications running out, dying of complications from diabetes. You're going to have women unable to give birth in a hospital and having birth complications. You're going to have children with infectious diseases who can't get the treatment they need. And you'll have many, many more deaths from coronavirus than you would otherwise have, because there aren't enough hospitals in the world. There aren't enough ventilators, and those are the breathing machines that are used to help people breathe when they've got severe respiratory distress syndrome from a viral infection like this one. So yes, you take the hit soon and you get a lot of immunity, but you also have much, much more damage to your population than you would otherwise have by spreading it out.
I'm going to make an appeal to our audience here to use, if you have a question, we already have 8 questions. If you have a question, to use the question and answer box. The reason being, they're very easy to follow, but also because there's actually a way of voting up or down for a question, and that can help us actually prioritize if we start getting so many that we can't address them all. And there's one by, put in by Eugenia Ambard, which has 1 upvote, so it's prioritized over the others at this point. Do you believe people should be able to travel from state to state? This is coming probably from the United States. Do you believe people should be able to travel from state to state? Should that have been something that was cut off in the beginning?
Okay, again, this is not my belief, but I am quoting what epidemiologists who understand the spread of disease have said. And they have said that travel restrictions like that in general are very, very hard to enforce and don't work. Because if you try to restrict travel too much, people will find ways around it. The only travel restrictions that work are drop dead, nobody goes anywhere travel bans. Because people, it's impossible to stop the flow of people. The other problem with these kinds of things are, if you announce a travel ban is coming, everybody will rush to get out. That happened in Wuhan, right? There's a rush of people who try to get out ahead of the travel ban, and they're carrying with them the seeds of the virus. Now, it's hard to reconcile that when you have something like, stay-at-home restrictions as opposed to outright travel bans. And the way they're handling it here in the US, the governors all met yesterday and agreed mostly that what they would do is tell people they have to stay home. They're not enforcing it like they are in France, making people carry a piece of paper and check in on the way out. I think it's generally agreed that banning travel across state lines doesn't work, and it makes people more likely to disobey what restrictions there are.
Great. Another question, this one from Sage Silberman, has 2 upvotes. Do you think that we are going to have an economic depression or recession? You needn't preface your answer by saying you're not an expert, Maggie, because you are. Are we going to have a recession or a depression?
A lot of people are predicting that we could have either. It depends a lot on how well businesses weather this time, and it's not looking good. The stock market's very uncertain. A lot of people have lost their jobs. That's a lot of money that's not circulating. I know some countries, as we were discussing, France is trying to support businesses. Here in the US, there's a giant multi-trillion-dollar initiative to support business and to also give cash money to people, so that the hope is not that they'll save it, but that they'll spend it and circulate it and try to keep businesses up and thriving. But every model that I have looked at over the decades has said that when there is a pandemic like this, it's going to really, really damage the economy. A lot of banking regulations and lending regulations have been loosened in certain countries, which makes these lending institutions more vulnerable. People aren't going to be able to pay their rent if they don't have jobs. They're not going to be able to pay their mortgages. They're not going to be able to shop much. So the predictions are pretty strong that without some kind of really spectacular measures coordinated by governments, yes, the economy will take a big hit. Does that mean a recession? Does it mean a depression? A 1920 style depression is unlikely only because there's more support around the banks and your money isn't going to disappear like it did back then. But there are many other things that can happen. I think a year from now, the global economy is going to look a lot different than it does now.
We've got some heavy hitters on this chat. James Kelly of Indiana University has put in a question. In yesterday's New York Times, Paul Krugman, everybody's favorite columnist, right? Paul Krugman argued that the problematic US government response is a result of a societal shift away from trust in science. How do journalists, like yourself, Maggie, how do journalists cover the diminution of facts responsibly? In other words, facts are a little bit in the doghouse right now in some camps. How do journalists cover stories like this when facts no longer carry the weight that they used to?
With great frustration. I have to say, I've been impressed because, yes, it has been a steady battle against people who say, well, I get to choose what I believe, and I choose not to believe those facts. I choose to believe other facts. And you're always struggling to explain, actually, there's only one set of facts. There are facts, and then there are beliefs, and the two things are separate. But as we, growing with growing tendencies, climate change, beliefs in vaccines, other things, people have started to say, well, this is up for debate, and I don't believe what you say. People also have access to Dr. Google, and it's an old saying for a reason that a little bit of knowledge is a dangerous thing. A lot of this doubt comes from people who have just enough education to have a great deal of confidence in their own ability to understand something. But these are complicated issues. These are matters that it requires years of study to understand and to predict. And what public health experts used to say about pandemics early on, they're not saying anymore because they learn from what is happening. What impresses me is that I feel like the media coverage of the coronavirus pandemic has been excellent. People have taken on board the necessity to talk to true experts who actually know what they're talking about. And I feel like by and large, what people are getting from mainstream media reports is pretty accurate. The problem is the proliferation of social media. And that has allowed anybody with a computer, keyboard, or a phone to have a voice in this debate. And I've seen certain items that claim to have some legitimacy really taking on a viral quality because they appeal to the human need to understand what's going on and then to share that understanding with others. And sometimes it's okay, it results in accurate information being disseminated, but it also results in a lot of junk. It doesn't help that world leaders have sometimes lost the ability to act logically. For instance, we've got 3 people in France. The French health minister inexplicably warned everybody against using ibuprofen, saying, well, I heard of some people who had coronavirus and they got really sick, so maybe we shouldn't use it. That's still going viral, even though the World Health Organization said, guys, we don't actually have any studies showing that. It probably doesn't hurt you to not take ibuprofen, but this is just not based on anything real because you need a study to show that. You need to compare in a scientific, methodological way, people who took ibuprofen when they were infected and people who didn't, and see if there's an actual difference in the outcomes. And make sure that those people who aren't taking ibuprofen are not avoiding it for other reasons because it's going to interact with their medication that they're taking for another condition. That one has continued to have legs, and it's frustrating to fight that. Luckily, there's a lot of hunger for facts right now, and I feel like people are in a mindset where they're ready to listen. Even with politicians like President Trump and with news organizations like Fox News, which were at first telling people this is not a big deal, this is not going to have a pandemic, even saying things like it's fake news, it's being baked up by left-wingers to try to attack President Trump. I think everybody's starting to change their tune, and they're in a position where they're willing to listen to some expertise. maybe that'll change attitudes towards science down the road. That would be great.
We've got a really tough question. Brian Zor has dibs on this next question and his second question because it has 5 upvotes. It's a tough one, Maggie. It's a really tough question. It's got a political slant to the second half of the question. If you don't want to answer it, what we can do is we can say, any attendees want to raise their hand, and we'll put you on camera, and then you can pontificate on this one. How's that? We'll make it a pure democracy here. But so here's the question. Have you ever reported on a health crisis during an election year? Again, I'm assuming this is a U.S. election year, although you've lived in Hong Kong and Beirut, and maybe there were health crises in those cities when you were there. But anyways, have you ever reported on a health crisis during an election year, and how might the Trump administration's response impact the upcoming U.S. election? Good luck with that one.
Well, people are already talking about that, right? And there's already speculation that the Trump administration might try to delay the voting so that he doesn't have to answer this at polls. It is clear that this administration, at least, paying very much attention to people's opinions and how they might affect his popularity and the outcome in the election. Trump actually has the highest approval ratings right now than he's ever had in his entire presidency. It's flummoxing some political analysts, but I have reported on crises during election years, including in London as well. And people tend to want to have faith in their governments during a crisis. There's an old saying about you don't change horses in the middle of crossing a river. It's just a dumb idea. People tend to have faith in their leaders because it's too scary not to. It's too scary to think, oh my God, an idiot's in charge of our response to this. So people want to believe that they're being led by level-headed and caring people. I wouldn't even dream of predicting how this is going to affect the election here or elections anywhere else. I think it's really having an effect in Israel as well, where there's been a lot of political back and forth and great swings in what's happening. It will affect it, though. It affects how people think. When people are frightened, they respond differently, and it will be really interesting to watch. I'd love to hear what anyone else on this call thinks about, though.
Yeah, well, again, if any attendee, that is people who are participating but not on camera, would like to offer their opinion on that or comment, feel free to raise your hand, and then we'll allow you to talk, or we'll even elevate you to the panelist level. Thinking of which, Dylan, you're a young person like Janae Rose. You had a question that I thought was pretty interesting. It also has a somewhat political aspect to it, but why don't you let it go?
Sure. So my question was really, I thought it was interesting when we saw that Boris Johnson was, tested positive for coronavirus, because he was also one of those people that at the beginning was saying this is not such a big deal and all of that. So I'm just wondering if you think whether the experience that Boris Johnson is now having, or that President Trump is having, seeing that this, he actually has to listen to experts, will that change things down the road, or are we just going to push ourselves even further from facts and go in a more, populist direction?
I think in every disease outbreak I've ever seen, there's always been kind of deniers at first saying, oh, this isn't such a big deal. And then there's often panic and overreaction. And then people tend to actually settle in, and they realize that what the experts have been saying has played out as they have predicted. I don't think Boris Johnson or Donald Trump, either of them, is a completely unreasonable person, and they will act on what's been shown to be true. We've already seen both of them, I think, moderate some of their statements and claims. And, Donald Trump very famously, when Ebola broke out in West Africa, he sent out this series of tweets saying, oh my God, it's going to get us. We need to stop everybody from coming back. No one should be able to come to the US from West Africa. And of course, Ebola did not spread out of West Africa. And he stopped saying things like that, even back then. And that was before he was president. People do manage their own responses. I don't expect to see a lot of unreasonable behavior. But politicians also want to be seen as doing something. And I've seen this again and again. I've talked to some of the people who are advising Trump off the record, and they've said, whatever we do, it has to be something that he can frame as a strong response. And I would imagine that a lot of political leaders are like that. They don't want to step back and let the experts respond. They want to be seen as taking strong action to protect their citizens and their countries. That's where you can run into danger. That's where you get things like travel restrictions, travel bans, and trade restrictions, which could hurt us, because no country right now is self-contained, especially when it comes to a medical response to something like this. We all have to import medical supplies. We all import drugs from other countries. India and China, China especially, has not only makes a lot of the drugs that go to the rest of the world, but they're also the source of the basic materials used to make those drugs and medical equipment. So you can't just cut China off, because if you are, you're cutting off your own head. Those are some of the dangerous things, though, that politicians might do as a knee-jerk response to be seen as being strong.
Maggie, do you think that countries, after this pandemic passes, will shift towards trying to produce more supplies self-sufficiently, as opposed to being reliant on other countries that might supply things like ventilators or basic foods or drugs or all of those things?
Countries have already done that. The US, there was a shortage of flu vaccine a few years back because a couple of the batches failed. And one of the big discussions at the time was this interdependence that the whole world had, and that the idea that if there was a pandemic and there was a shortage of medical supplies, that countries would nationalize their supplies. So even if the US had a contract to buy flu vaccine from, say, Canada, where many flu vaccines are made, Canada would say, we need them for us, you can't have them, we're nationalizing our supply. So the US started building vaccine factories, encouraging companies to do so, and that had to be done with tax breaks and incentives, because of course it's a capitalistic economy, and the US doesn't, the government doesn't make vaccines. A few other governments have done that too. And there was a news story a little while back about a vaccine plant or it was a plant making drugs in Germany that apparently President Trump had approached the company and said, we'd like to buy up the whole supply. And the German government got involved and said, wait a minute, this is being made on our soil. Governments are aware that this is a vulnerability, but they're also aware that these are expensive products to make, and people are clamoring to keep prices down. Drug prices, that's a big political issue in the US. And if you make drugs in the US, they're going to be more expensive than if you make them in China. So yes, governments are aware of this and are working a little bit, but it's a very, very slow process. And it's very hard to disentangle these economies of manufacturing that are global.
Mm-hmm. Sure.
Maggie, we were talking just a moment ago about facts, and if you had to list your three most crucial sources for information when it comes to this pandemic or illnesses in general, what would they be?
That's easy. The CDC, despite having been
tell our viewers from outside the United States what the CDC is.
The Centers for Disease Control and Prevention, which is the agency that's tasked with fighting disease when it happens. And the CDC normally would have been briefing every single day on this outbreak. Every other disease outbreak, they've been briefing journalists every day on what's happening. Nonetheless, President Trump has taken that and turned the daily CDC briefing into a White House briefing, and there's no CDC official there briefing. So there's a dearth of that information. Despite that, there's still a very trusted source for journalists like myself. We know that what they tell us is going to be true, and that they're doing their best to get the right information out there. So that's a trusted source. The World Health Organization has really stepped up as a source of information. They are doing more than I have ever seen WHO do, updating what's known, what's not known, putting out infographics that are easy to understand, putting out fact sheets that are easy to understand. They're a great source of information. And as always, we rely very heavily on the medical journals, and journals like the New England Journal of Medicine, the Lancet Medical Journal, the Journal of the American Medical Association, Science and Nature are all rushing out any studies that are being done by teams of experts around the world that could shed light on what's happening. So between the journals and these two large agencies, we've got huge amounts of information coming in that I feel are reliable. It's just a bit of a fire hose, to be honest, but those are the good sources. The bad sources are social media, are the self-proclaimed experts on social media. And unfortunately, which makes it really hard to report accurately on this pandemic, some of the politicians and lower level health ministers who are trying to weigh in, and I think they're trying to be helpful. I think most of them are well-intentioned, but are sometimes spreading some misinformation.
Including on the ibuprofen, as you mentioned earlier.
Including on the ibuprofen, yes.
On the question of ibuprofen, or the example you gave, you know, in a situation where you don't have maybe the time to conduct a scientific study on how ibuprofen is affecting COVID patients, isn't it best to issue that warning at the outset, and then if you're seeing some kind of adverse reaction, like sometimes isn't delaying for a study actually sort of more harmful?
No, because you could do more harm than good with something like that. Now, ibuprofen is not necessarily a life-saving drug. But what you do is you have people turning to other things. With a viral infection like this, most people, there's nothing you can do for them. I mean, if people have severe breathing problems, they're in the hospital anyway, and they're you know, under the treatment of a doctor. But for most people, you're staying home, you're self-treating, and the main symptom is misery. People who are miserable might not be doing the things they should be doing, like getting enough sleep and getting enough fluids. And you could have an inadvertent effect on people by telling them not to take the one thing that will make them feel better. The one, you know, give the one thing to their child that will make their child stop crying. And there can be other unanticipated side effects when people say, I have to do something, so I'm going to turn to something else. Luckily, we have an alternative, which is Tylenol, which is also a very safe drug that people can take, but people might turn to alternative medicines. They might turn to unproven treatments. A better example of where you can do harm with saying something before you know is this whole outcry over the anti-malarial drugs, the chloroquinolines, and President Trump, for reasons that remain poorly understood, saying that this drug offers more promise than it actually does. There is zero evidence that this drug is efficacious in COVID-19 infections, but people are taking it. There was a case of a man in the United States who looked at his fish tank disinfectant, saw it contained a chemical that had the same name, and took some of it and died. People will do stupid things. People are buying it up, and these drugs are prescribed for other conditions. They're prescribed for autoimmune conditions like lupus. And people with those conditions who need the drugs are now saying that they are having trouble getting it because so many people believe that it will save them from COVID-19. So when you don't study things, you have unexpected outcomes. And if you've already got very sick people, the last thing you want to do is give them a drug that could make them sicker.
Indiana University is extremely well represented in this town hall, including two heavy-hitting professors there. One, Elaine Monahan, and she and you know Elaine. She says the FDA has just approved the 2-minute antibody test. What does your expertise tell you about the potential impact of that? And I guess more generally speaking, what about vaccines and cures? What's going to happen?
Well, the more tests, the better, right? The FDA is rushing to approve tests because we still have no idea how many people are infected. because there was a great delay in getting tests out, and some of the tests that got distributed at first were not accurate. So the only thing worse than no test is an inaccurate test that gives you no idea of what's going on. You need diagnostic tests for two reasons. One is a public health reason, so that you can see where the virus is, who's infected, and how it's spreading, so that you can then have measures to help control it. And the second reason is for the individuals, so that they know what they're infected with. Right now, there's not a great reason for individuals to get tested for their own benefit, because it's a viral form of pneumonia and there is no drug that can treat it. So the only treatment is self-treatment, or if you're very, very ill, supportive care in the hospital, which is a ventilator. With any respiratory disease, you really should stay home and avoid infecting other people. But it is true that this is a new one, and people are taking way more care than they would to not infect one another. And of course, healthcare workers who are treating you need to know that you have this infection, so that they can take extra measures to protect themselves when those measures are available. Now, an antibody test has an extra benefit in that you can go back and look at people who thought they were infected, didn't know, and never were diagnosed. You can see if they are immune. That's another question that we don't have good answers for, but in general, people who have been infected with a coronavirus, and there are several that infect people every year, they have some immunity for at least a couple of years to getting that infection again. So if people could be identified who have immunity to COVID-19, that would be great, because they would know that they are safe to go back to work, to go out into the world, grocery shelves, to, if they're healthcare workers, to go in and help treat patients, and they don't need to take the extreme protective measures that others would. And again, would paint a picture of where the disease has spread in the past. If there are communities that have already been hit hard by the virus and people have had it and recovered, then you know that you can move some of the extreme public health measures to other communities where people are more vulnerable. So the FDA knows this, the CDC knows this, the World Health Organization knows this, governments know. They need to get tests out there. And the two kinds of tests are the diagnostic test to tell you if you're infected right now, and the antibody test, which will tell you if you're infected now, or if you've been infected in the past. Those things are.
I have a question. I wanted to ask, could you maybe expand on why is it, for example, South Korea right now has been getting a lot of fame because of all the tests that it has been able to push out and how fast it's been able to do it. Could you tell us maybe a little bit why it was that South Korea was able to get out so many tests so quickly and the US had such a delay?
South Korea has always been at the front line of pandemic fears. When H5N1, I was telling you at the beginning, started breaking out among poultry flocks in the 90s, and then in the early 2000s, South Korea was one of the countries that was hit especially hard. Some of the first cases were there, and then they had a spread of cases. So the government there is very attuned to the risk of a pandemic. South Korea has a lot of, trade lines with China and with other countries, and so they're vulnerable to the import of some of these new and emerging diseases. South Korea is also, although it's not a small country, it's a contained country, and it's one where there's central government, and so there's central control of distribution and manufacture of tests. So it was something that their national government could say, you know what, we're going to pay attention to tests, and we're going to make sure that we're ready to step up and manufacture and distribute these tests quickly. The population is more homogeneous. It's difficult in the States because in the States, medicine and health is regulated by the states. There's very little federal regulation of health. It's a state-by-state thing. The CDC can help, but the CDC is kind of like a vampire. They have to be invited in. The CDC can't step up and say, okay, you all are all testing and this is what you're doing and this is how you're doing it. It's more voluntary, and it's a very heterogeneous society. You know, some states, like states in the South, are more resistant to having someone tell them how to do things. Other states like California and New York are very responsive and more collaborative. So it was always going to be different. It was always going to be a more fractured response in the United States. than it would have been in South Korea.
Our two panelists from the South were just nodding as you said the South is more resistant, Maggie. We have a question from Professor Joseph Coleman of Indiana University. He says, and this is right in your wheelhouse, Maggie. You'll knock this one out of the park. Maggie, do you have any advice for student journalists who are trying to cover this pandemic in their communities?
Boy, this is such a great opportunity for you as student journalists. I think this is a terrific opportunity. I've got a good friend who happens to be a professor at Indiana University. Who could that be? It might be Elaine Monahan. I have friends who are professors elsewhere, and I've taught to some of their classes, actually. This is one that you can report in real time as if you were a national journalist. You can actually watch the White House press conferences every day and report on them real time if you want to, from a national perspective, but also from the perspective of your own community. This is a time when community journalism has actually really fallen apart, right? We've all lost local newspapers. We've lost local television stations. Coverage has been cut way back. There are a few microsites, but there are big holes in coverage, especially in local news. And that's where student journalists can really help. You can look at what measures are being taken in your own community. I've noticed that governors and county health officials are all having their own briefings and news conferences. They all have websites with information. They're all responding in different ways. And for instance, North Carolina has some really strong local health systems. They've got really, really powerful officials there who are interested in public health, interested in helping their communities, and they've taken some innovative measures. And reporting on them locally is something unique. You could possibly be the only person reporting on what's going on in a particular county. So it's a chance not only to do on-the-job learning, but to actually serve your community and be a useful source of information to the rest of the world and to your community. I think this is a great opportunity for student journalists, especially if they're led by somebody who can help manage what they're doing, but also help get word out about the reporting that's being done. I think a lot of, especially county and city and local health officials would be very open to speaking to you. Universities are taking really extraordinary measures, and they kind of vary in their response to how open they want to be and how accountable they want to be to not only their student body, but the communities that they're serving. So even reporting on your own university or your own school is a great opportunity. The more information, the better. And as long as you stick to standard reporting ethics and value the facts, check your facts, put them in context before you report them, this is the best on-the-job learning you could do.
Are there stories, Maggie, that student journalists could cover that you think are being underreported?
Yes, for one thing, what universities are actually doing, how they've responded. There's a big hole in finding out, for instance, what is happening with international students who don't have anywhere to go. Are universities kicking people out of the dorms? Are they keeping them in the dorms? How are they keeping the dorms clean? What about some of this quasi-dormitory housing that many universities have? They have subsidized apartments. What's happening to those students? Where are they going? How are they living? Are the universities able to help them? Many students receive their health insurance through a university. How is the university managing that? Where will these students go if they get sick and need treatment? Many of them have gone back to their home states. How will the university-sponsored insurance cover them in the states that they're in? There's so much that you could be reporting on. How's the distance learning working? How are professors coping with that? How are students coping with that? Some communities, a lot of the students have wireless, and the county I live in, for instance, has distributed Chromebooks to every student who doesn't already have a computer, but I live in a really rich county. What's happening in some of the poorer counties? I guarantee you there are parts of this country where the kids have gone home and they are doing nothing at all, and their schools are doing nothing at all, and the whole rest of the school year is going to be lost. What happens to them? What are organizations like, you know, College Board, which administers so many tests? How are they handling that? And those of you who were involved in school year abroad, is there any way you can communicate with students in the country that you were going to visit and compare how their school systems are handling this as opposed to yours?
Wow, that's a question. Maggie, I'm glad you weren't my news editor. You would have had me running all over the place, running down 100 different stories. Those are fantastic. Elaine Monahan, I hope you heard those. I hope you heard those suggestions, and we look forward to stories by your students for News Decoder. Janae Rose, are you able to be in touch with Spanish students now that you're back in the U.S.?
Yes, I've been in touch with my host sister, and she's in elementary school still, but mainly what she's been doing is pretty much what, like just online lessons, and she gets homework sent to her every week and she fills them out and then sends it back to her teachers, and just standard online classes.
There's another question for you, Janae. We're going to let Maggie have a sip of her coffee and take a breather here, because there's a question from Ms. Baker, Kim Baker, of you, Janae Rose. What did you notice in terms of the Spanish population's attitude towards the virus right before your hasty departure? Did they seem concerned?
So in the city that I lived in, Zaragoza, it's in between Madrid and Barcelona, and it's not as big as those two cities. So most people were definitely more relaxed because we were not hit as badly. But I know that in cities like Madrid and Barcelona, before the lockdowns, a lot of people were working from home, but really they were partying and having like a good time. But now I've talked to people that are still living in Spain, aside from my host sister, and a lot of them are very nervous and staying at home. But right before I was leaving, it was just beginning to really become serious for a lot of people.
Right. Well, we've got exactly 4 more minutes, guys. So we're going to try to get in as many questions as we can. There's one with a record 4 upvotes here from Julia Kalinda. Ms. Fox, do you think that there will be a time this year that we will be able to go back to some level of normal life?
Hopefully by the fall.
Fall Northern Hemisphere, so it would be
in the Northern Hemisphere, autumn. That falls in a very American word, but you know, September, October, November. Let's hope, but really a lot does depend on what happens over the summer.
So are you looking, Maggie, for restrictions on movement through the summer then?
I think so. I mean, a lot of places have already said our restrictions go until June, and that's very far-sighted because this is not going to go away, and our hospital systems aren't going to recover that quickly, and we're certainly not going to have a treatment or vaccine before, I would say, December would be unbelievably fast. It's going to be a year from now before we have any kind of real intervention for this, and because the entire global population is vulnerable, a lot of people still are going to get sick. And whether you have restrictions or not, having that many sick people is going to affect everybody's life.
We have a question from Ojai, California, from Jake Jacobson. Do scientists working on treatments and vaccines have a platform to communicate with each other? WHO, for example?
They do. In fact, it's the medical journals, and that's been the platform that they've always used. And there is a lot of free sharing of information. Usually scientists are in contests with each other and they compete with one another, but on this particular thing, they're sharing their information. There's an open publishing platform called RX Archive. I can't remember how you pronounce it, but there are pre-publication sites where people are throwing their data up as soon as they get it for other scientists to look at, to synthesize, to try to replicate and to comment on. So yes, there is much open sharing. It's not through any one agency, it's through kind of the free-for-all medical journal system that we have.
And the last question from the resistant south of the United States, from Kirsten Boner of PACE Academy. She says, I'm confused by different advice from specialists on how strict to be with social distancing. Some seem to suggest that small groups are okay. This makes me feel that I'm being responsible if I go on a walk with a friend and just try to stay a little bit away. But then other specialists say, if I interact with one person out of my home, then I'm really not doing my part to break the chain. How can I sort through medical advice that differs even slightly?
You're right. That's a really hard question to answer. What you have to think of is, what is the risk that the person you're interacting with has had other interactions as well? Because it's like, what's that old saw about, when you have sex, it's not just with the person you're having sex with, you have sex with every other person that person has had sex with. And it's the same with any infectious disease, especially a respiratory one. If you're interacting with your best friend who is staying home all the time too and not interacting, and you're not interacting, then you all aren't adding any more risk to that interaction when you interact with one another. But if you go out and interact with someone who went to the store and they went to the hospital and they went to the pharmacy and then they interacted with you, or you did those things, then the risk is greater of interacting with that person. So you have to kind of look at the global risk that the various people you're interacting with represent altogether. Does that make sense? I think I made it more confusing.
Well, she's not on camera, so we'll assume that the answer is adequate. And we've run out of time. Again, we're very punctual. It's one of our journalistic behaviors that we like to inculcate. So Maggie, thank you very much for that tour d'horizon of the coronavirus and various aspects, including politics. And I want to thank everyone. This has been our most popular event on camera ever. It's a bit of an unfortunate topic, but we'll get over this, I'm pretty sure. Stay tuned to News Decoder. We've had quite a few stories already on coronavirus, and we will have others. And we're always welcome. We always welcome submissions from students, of course, on this topic or any other topic. So with that, we'll close it out. Thank you for those who were participants off camera. Thank you very much to the participants on camera, especially Maggie Fox. And I wish you all a very good day or evening, however it may be, and please stay safe.
Thank you.